Good to go. All right. So I'm gonna do inline suction with the patient with the trachea, with the tracheostomy. So what I want to do first, I want to protect myself and the patient. I want to do universal precautions, which is I first put on the mask, then I go ahead and put on my gown. And then I want to go ahead and put on my gloves. I'm going to go ahead and get my cow, check my patient chart, make sure that he's due for sexual inline suctioning, which is Q4 in this case. I'm gonna go inside the room. Hello, Mr. Smith. I'm gonna go ahead and suction you out. Make sure that you have a clear airway clearance. What I want to do now, I want to go to my ventilator. Make sure that his settings are fine, that he's saturating good and everything. I'm going to go ahead and increase the FiO2 at 100% and press the suction button. Meanwhile I suction, I also want to keep an eye on the ventilator monitor, making sure that he's still setting good on the saturations and his heart rate also. So I'm going to go ahead and go to the other side because I'm right-handed and that's my dominant hand, which I want to grab that the tracheostomy tube, cannula, and then what I want to do is set up my vacuum. It should always be running vacuum. It would be preferably we have a double connection, one with a Yonker and one into the inline suction catheter with the Yonker to suction out any secretions created in the mouth. Since he cannot swallow, there will be some accumulation of secretions in there and it will dry out and it might cause any gum disease or anything like that. So I want to have a Yonker also. So the way I want to suction this is I want to hold the tracheostomy really tightly. Make sure I don't put my hand over the patient. Try to keep my hand away from the patient's mouth or anything like that. Then I'm gonna go in while pushing in and then pulling out the plastic. Pushing in, pull out the plastic, and repeatedly do that until we meet resistance, which is the resistance is gonna be at right at the carina. What I want to do after I meet resistance, I want to pull out at least 1 centimeter to make sure that the patient, so we won't suction out any tissue or anything like that, or create any scar. So I want to press the button and then suction. I want to make sure that his saturations are still good, and I'm gonna let him breathe out for like another 10 seconds, and then I'm gonna go back in there, keep on pushing it until I meet resistance. And then I wanna suction the patient one more time. Making sure that everything's okay. I wanna go ahead and lock this again for safety reasons. And go ahead and check his saturation, that everything's good. Tell him that I'll be back like in another 4 hours. And that's it. Then, how much time do I have?
4 minutes.
4 minutes? Okay. Just make sure that he's saturating well, his blood pressure is okay, that he doesn't turn, blue or anything like that. I'm gonna go ahead and auscultate a muscle. Let me just grab a stethoscope right away.
Okay.
So I'm going to go ahead and listen to his lungs, make sure that he's breathing okay, or that actually from this suctioning, make sure that at least I clear out some type of rhonchi or anything like that. Listen to his lungs. All right, Mr. Smith, you're okay, and I'll be back and see you soon. Okay. Thank you for cooperating with me, Mr. Smith, and thank you to the world.